Exclusive. Shocking new research reveals a reproductive health crisis affecting millions of women in England. A groundbreaking new study unveils a staggering reality. A quarter of all women in England are silently battling serious reproductive health issues. This isn't just a health concern, it's a public health crisis demanding immediate attention. The largest survey of its kind, encompassing a remarkable 60,000 women across England in 2023, paints a stark picture of widespread suffering and systemic failures within the healthcare system. Funded by the Department of Health and Social Care and meticulously analyzed by experts at the prestigious London School of Hygiene and Tropical Medicine, LSHTM, the research provides the most comprehensive assessment to date of reproductive morbidity in England. The findings are alarming. A full 28% of participants reported living with a significant reproductive health condition. This translates to millions of women silently enduring debilitating symptoms, impacting their quality of life, work, relationships, and overall well-being. The conditions identified include a range of debilitating issues, such as pelvic organ prolapse. This distressing condition affects the pelvic floor muscles and ligaments, leading to organ displacement and a cascade of painful and disruptive symptoms. Uterine fibroids. These benign tumors can cause severe pain, heavy bleeding, and infertility, significantly impacting a woman's physical and emotional health. The prevalence of uterine fibroids is particularly concerning, affecting an estimated significant portion of the women surveyed. Endometriosis. This chronic, often excruciatingly painful condition involves the growth of endometrial-like tissue outside the uterus. Endometriosis can cause debilitating pain, infertility, and significant disruption to daily life. The significant number of women affected highlights the urgent need for improved diagnostic and treatment options. Polycystic ovary syndrome, PCOS. PCOS is a hormonal disorder affecting the ovaries, leading to irregular periods, excessive hair growth, acne, and weight gain. The long-term health implications of PCOS, including an increased risk of type 2 diabetes and heart disease, further underscore the severity of the issue. Gynecological cancers. The survey also sheds light on the significant number of women living with cervical, uterine, ovarian, or breast cancer, highlighting the importance of early detection and access to quality cancer care. These are not isolated incidents. These are widespread health concerns impacting millions of women's lives in profound ways. The sheer scale of the problem demands immediate action. The research, however, goes beyond simply identifying the prevalence of these conditions. It also exposes critical failures within the healthcare system that prevent women from accessing timely and appropriate care. Dr. Melissa Palmer, the lead author of the LSHTM research, emphasized the significance of the findings. For the first time, we have a robust estimate of the percentage of women and people assigned female at birth experiencing reproductive health issues. This data is crucial for informing policy and resource allocation to address this critical public health concern. Dr. Palmer's words highlight the crucial role this research plays in shaping future healthcare strategies. The study further underscores alarming racial disparities in access to care. Professor Faye Ruddock, chair of the Caribbean and African Health Network, shared a deeply concerning observation. Nearly every other Black woman I've spoken to has experienced reproductive health challenges like uterine fibroids, endometriosis, heavy bleeding, and painful periods. This disparity highlights the urgent need to address systemic racism within healthcare and ensure equitable access to quality care for all women, regardless of race or ethnicity. The experiences shared by Professor Ruddock serve as a powerful reminder of the lived realities of many women facing these challenges. The research identifies systemic, operational, structural, and cultural issues hindering women's access to care. These issues are not merely logistical hurdles, they represent deep-seated problems within the healthcare system that must be addressed urgently. These issues include lengthy waiting times for appointments, difficulty accessing specialists, a lack of awareness among healthcare professionals, and insufficient funding for reproductive healthcare services. The 28% figure is not just a statistic. It represents millions of women facing pain, suffering, and significant disruptions to their lives. This groundbreaking study serves as a wake-up call, demanding immediate action to address the underlying causes of this crisis and ensure that all women in England have access to the timely, high-quality reproductive health care they deserve. The systemic issues preventing women from receiving appropriate care must be addressed with urgency and commitment. The data provided in this study is invaluable in guiding the development of effective interventions and policies to tackle this critical issue. The fight for women's reproductive health is far from over. This research provides crucial ammunition in the ongoing battle for equitable and accessible healthcare.